My dog is on Viagra and I don't put my patient on it? Find out why. Why is my dog on Viagra and I don't put my patient on Viagra? Well, stay tuned to find out. Hello there. This is my dog, Bodie. He's 11 years old, but he has heart disease and he has pulmonary hypertension, which is high blood pressure in the lung. And he's on multiple medication as well as Lasix. And poor guy, the vet told me that he's going to have about 3 months to live, but it's been a year and 2 months now, and he's still here with us. And you know why he's still here? It's because I put him on Viagra. Yes, sildenafil, the ED medication. My dog don't have ED. In fact, he was neuter when he was young. But I put him on Viagra because the way the Viagra works is that it opens up blood vessels so that way to reduce the hypertension or the high blood pressure in his lungs to allow him to breathe better because Bodie at nighttime he coughs a lot and he has trouble breathing. So since we put him on Viagra, low dose Viagra, he's actually breathing better and it's bought him another 8 months with us. When the vet says he probably have just 3 months alone. That's why I put him on Viagra because help him breathe, not because it helped him with his erectile dysfunction. And that's one of the reasons why I don't give my patient Viagra. It's because I don't give it to them for pulmonary hypertension. The reason why I don't give my patient Viagra when they have ED is because my get hard system concentrate on the sixth system that help you get an erection, right? Which is the brain, the hormones, the emotion, the nerve, the blood vessel, and the muscles. So how Viagra works is that it helps the penis muscle or the corpus cavernosum relax. So that way you can get more blood vessel in. But the reason how it does that is that it inhibits the degradation of an enzyme called cyclic GMP. And therefore that cyclic GMP stays longer, and therefore nitrous oxide stays in the muscle longer. And that's how it opens up blood vessels in the penis, right? But it doesn't increase nitrous oxide directly itself. And when you take Viagra, it only helps with the penis, but ignores the brain, the emotion, the nerve, the hormones, and the blood vessels action. So it's essentially just addressing 1/6 out of the problem. And men with ED are not taking it for pulmonary hypertension, like Bodie here. So when you take it, what it does is that it really creates more side effects. One of the side effects of Viagra is headaches and vision changes and nasal congestion. And one of the problem is actually you can have long-term hearing loss and visual loss, not to mention risk of priapism, which is an erection lasting longer than 4 hours. So having said that, I want to stress that when you're taking Viagra, you're really ignoring the cause of why you have ED and not working on the cause, but just padding the problem. So, guys, if you're taking Viagra, you're not taking it for pulmonary hypertension, really relook at what you're doing because you're just bearing the problem of why you have ED deeper in the sand and not looking at the cause of the problem. When the cause of the problem could just be high blood pressure, stress, you're not getting enough sleep, or maybe it's you're smoking, or maybe too much alcohol, overweight, you're not exercising enough, when you can actually reverse your ED by just simply concentrating on those simple lifestyle modification factors. And that's why I'm passionate about educating men on sexual function because I don't want you to take medication because it is a trap and it is not going to help you in the long run. In fact, it's going to make your ED worse in the long run because you're not addressing the cause of the problem and just letting the cause of the problem just get worse over time. That's why men over time see that Viagra medication or Cialis just doesn't work as well as it used to because the cause of the problem gets worse. And one of the problem is that nobody tells you that, right? Everybody said, wait, ED, here's a medication, just take it, right? But when you're taking Viagra medication, it's almost like taking Oxycontin, Percocet for your pain. you're just band-aiding the problem and not treating the source of the problem, right? So let's say for Bodie here, he has pulmonary hypertension and he takes Viagra, he's breathing better. Look at him. He used to be in so much distress. This is his first time on camera. And he's so nervous right now. He's on my lap, and I'm grateful for him to be with us for another really 8 months from when the vet would think that he wouldn't be here longer than that. So, having said that, just rethink if you're taking Viagra, maybe rethink about stopping it and really looking at the cause of why you have ED. Follow my podcast because I listed many multiple reasons. And sometimes it's just as easy as just changing your diet to a Mediterranean diet and stop eating simple carbohydrates. It could even make your ED worse. And I have other episodes we discuss about that as well. So let's together create a sexual revolution where you can have your sexual independence without relying on a medication and without thinking that you're going to need surgery to get your erection back, because your body is made for you to get an erection and your body is programmed for that. And just know that you can get an erection even to your 80s and 90s. And just know that you need to know what you need to do to maintain that. And I hope to get you there. All right. So I hope for you to be like Bodie, who's living beyond his years. And I'm grateful for that. So having said that, I hope that you find this useful and like and subscribe. And I'll see you in the next episode. Hello there. Want an amazing sex life? This free gift is going to give you more sex by helping you get harder and lasting longer. Let's talk about the most sensitive subject, the effect that aging has on your sex life. If you're over 40, there's about 67% chance that you have to deal with one or more of these issues. You sometimes go soft in the middle of sex. You sometimes have trouble lasting long enough to climax. Your erection just doesn't feel as hard as it used to be, and your penis is not as sensitive as it used to be. You cannot reach orgasm or ejaculate. You sometimes have trouble getting an erection. These things lead to frustration and embarrassment when you cannot please your partner. My name is Dr. Ann Truong, and I've been treating men for issues like this for over 25 years. As a board certified medical doctor who specializes in men's health, I helped over 7,000 men reverse the effect of ED. As a way to introduce you to the ED treatment that I offer, I want to give you the most incredible free gift ever. But don't let the fact that it's free gift fool you. This powerful gift will help you get harder and stay and last longer, and may just revolutionize your sex life, making sex more exciting, more thrilling, and an amazing experience again. How is that? So here's what you're going to get in this most incredible free gift. Number one, a good morning wood smoothie recipe. This is my specially formulated antioxidant recipe that will help you get harder and stay and stimulating more blood flow. It is formulated to increase your nitrous oxide level, which is one of the biggest keys to making you harder and firmer more often, and will also help you last longer. It is filled with lots of greens that create more nitrous oxide in your blood. This smoothie will give you that morning wood effect and will also make you harder on demand when you need it most. And you'll see the effect in about several weeks. Number two, nitrous oxide testing strip. You will also get two of these strips, which you will use along with simple instruction to test your nitrous oxide level in your saliva. Nitrous oxide is a gas in your body and is required for good blood flow to the organ. The strip can determine if your nitrous oxide are deficient, which can help us advise you on the best way to reverse your ED. Even more important, since ED is an early warning sign of problems with circulation and heart health, this can also be a great way to prevent heart related problems such as strokes and heart attack. Number three, and the best part of all, a 30-day free trial access to the Modern Man Club. As part of our mission to make men hard again, we launched the Modern Man Club as a way to provide education and support to a community of men who's on the path to reversing their ED, with pre-recorded and live session being offered every week. I will help men regain sexual health through training, support. I will be there all the way with you to hold your hand through, so that way you can overcome ED and have your best sex life. Members rave about this session and the sense of community they gain by being a member of the Modern Man Club. And all you have to do is to say maybe to this offer. And once you say maybe, you will be on your way to a more fulfilling and exciting sex life. So all you have to do is fill down the form below, and then I will see you on the inside. Thanks for listening to the Sexual Health for Men podcast. If you love this episode, then please take a screenshot on your phone and post it on Facebook, Instagram, or wherever you post. And be sure to tag me and let me know why you like this episode and what you like to hear in the future. That will help me know what's great for you, and I would love to give you the most incredible free gift designed to help you improve performance quickly. Go to my website at sexualhealthformenpodcast.com to get the book, The 5 Common Costly Mistakes Men Make When Facing ED. I would appreciate it if you subscribe, leave a review on Apple Podcasts or wherever you listen, and just know that you can have sexual vitality for life. I appreciate you. Until next time.